Welcome, welcome. This is Aruna Patki, the doctor of Ayurvedic medicine, a healer, a board certified TMB therapist, and a healer. I'm here to share one of the most important therapy in Ayurveda, which will help us to enhance the digestive system work in the body, to increase the concept of fire in the body, to increase the concept of Agni concept in the body, to increase and enhance the cellular metabolism, to increase the health, the wellness, the concept of Ayurvedic detox, the concept of Ayurvedic healing, the concept of Ayurvedic approach, the concept of Ayurvedic prevention or preventative approach of Ayurveda. So friends, we at Ayurveda Healing Spa in Concord, North Carolina, USA, we are always offering the services which are very important and which are very therapeutically have the effects on the body, which works on the body as a major therapeutic approach. The therapy work itself works as a therapy of detoxification, therapy for panchakarma, therapy of panchakarma, all these different techniques of Ayurvedic therapies, Ayurvedic services, Ayurvedic healing, Ayurvedic body type approach, Ayurvedic Prakriti concept, Ayurvedic Vikruti concept, Prakriti balance, Vikruti imbalance, the Ayurvedic concepts of using the mind, body, soul wellness, the Ayurvedic approach of bringing the mind, bringing the soul, and bringing the body all together, right? It is the concept in Ayurveda that we always have praised, the concept of health, the concept of prevention, the concept of wellness, the concept of swasthya in Ayurveda. Okay, and for all these achievements of health, or for the achievements of health and wellness, Ayurveda has given many major different tools to use on the day-to-day basis. Many tools to use on the daily basis so that you can apply them on the daily basis. You can apply them on the regular basis as a part of Dinacharya, which means the daily regimen, and Ratricharya, which means the night regimen, and Rutucharya, which means the seasonal regimen. So Ayurveda has given all these different regimens to follow along with your current status of the body, current age of your body, along with the status of your location on the earth, Deshadusham balam kalam sattvasatmya aharam. This is the way Ayurveda thinks, and this is the way we offer the services, and this is the way we like to see and heal our clients in the United States and our patients globally throughout the out of the USA. We like to see all these concepts which are mentioned in Ayurveda. Again and again, I will repeat this because this is very important, the way as an Ayurvedic doctor can think, and an Ayurvedic doctor who is learned Ayurveda through the Guru Shishya Parampara tradition. The Ayurvedic doctor who have learned Ayurveda through the Guru means the senior Vaidyas, and Shishya means the student who has studied Ayurveda through these traditions of Guru Shishya Parampara. We are not talking about the parampara or the tradition where we learn Ayurveda online, or not we are talking about the tradition of learning and studying Ayurveda through the YouTube, or not the tradition of Ayurveda, where we Google the things and where we watch all these social things and study Ayurveda on your own. So we are not talking about that kind of Ayurveda. We are talking about the Ayurveda where I have studied through my guru the ways of looking at the concept of health in the body and the concept of wellness in the body and the concept of preservation of the body. So I always and always and always will repeat the same sentence again, that health in Ayurveda is a healing, not for only the physical body. The concept of health comes like this: samadoshaha samagnischa samadhatu malakriyaha prasanna atma indriya manah swastha iti abhidiyate. That means, the meaning of this verse or this phrase or this sutra is samadosha, that means balanced doshas, balanced tissues, and balanced malas, or the wastes of the body, where we are talking about your bowel movement, where we are talking about your urine, and where we are talking about your sweat of the body. Sweat is like a waste of the body in Ayurveda. So we always have given the importance to the balanced and harmony in the Vata Pitta Kapha, and balanced and harmony in the Rasa Rakta Maunsa Meda Asthi Majja Shukra. That means balance in the plasma tissue, balance in the blood tissue, balance in the muscle tissue, balance in the fat tissue. Then comes the balance in the bone tissue, then comes the nerve tissue, and then comes the reproductive tissue in the body. So the health concept in Ayurveda comes as balanced and harmony in the VPK, Vata Pitta Kapha, and balance and harmony in the 7 tissues, where I will repeat: plasma, blood, muscle, fat, your bone, nerve, and reproductive tissue, and balanced or harmony in our potty, which means our bowels, urine, which means our mutra, and swed, which means our sweat of the body. So when these are balanced on the physical level, then there's supposed to be a balance also on the different levels of the body. And these different levels of the bodies, which we talk about: prasanna means happy soul, Atma, Indriya, Mana. Atma means soul. Indriya means 5 sensory organs in the body, where we are talking about our 5 sensations, which comes from the 5 elements in the nature, 5 sensations in the physical body. So if you see this picture whole represents the whole Ayurveda. Okay, this is the whole Ayurvedic concept right here behind me. So these are the 5 elements here, 5. I hope you all can see what I'm showing here, the 5 elements. So all these 5 sensory organs supposed to be working properly. Samayogaha. Sama means, again, their status is balanced. Okay, so the balanced of the sensory organs and mental health, the mind, which is connected with the mental health, and the prasanna atma, that means which is connected with our happy soul. So when we have the happiness in the soul, when we have the happiness in the mind, and when we have the happiness in our 5 sensory organs, 5 sensory organs, right? What are they? We know the sensations in the body, right? Sensations are always felt with the mental aspect of the body, and sensory organs are always felt on the physical body. Any guesses what are the 5 sensory organs I'm talking here? Does anybody know the 5 sensations in the body or 5 sensory organs in the body? Yeah, so they are called it as a ear, eyes, nose, tongue, and our skin, right? Skin. So we are talking about our eyesight, we are talking about our hearing, we are talking about our, what comes through the nose? Any guesses? Smell. the sensations of the smell of the food, smell of the nature, smell of the flowers, smell of the anything what you have around you. When you have good sensations, this will be working well, and this will be working very properly. And we are seeing this during this any viral attack, or during the viral attack we see that this organ is not working properly. So sensations of the smell. And the last sensation is our touch, right? Our sensations touch. Okay, so these are the 5 sensations which are connected with the 5 elements in the body: earth, water, fire, air, and space. So Ayurveda sees 5 sensations, their health. Now if we see in the current time period, when we are talking about the current condition, we are talking about this, that we are unable to smell the things, we are unable to eat, or we are not feeling hungry, or we are going through nausea, vomiting, sensations, overproduction, mucus congestion. These are all the things which can come with the disharmony in your 5 sensations. One of the out of the 5, one of the sensations. So every sensation is important, every sense organ is important, and every sense organ's action on the body and their rhythm, their balanced state is also very important. So this is the concept of health in Ayurveda. You cannot just achieve your health only by doing the diet concept, not at all. Okay, on the Ayurvedic dimension, on the Ayurvedic approach, through the Ayurvedic eyes, if you want to be healthy and if you want to be happy, then these are the 7 to 8 dimensions you have to follow, you have to manage, and you have to think before you are healing someone, before you are offering your healings, and before you are offering your work, your healing, your approach of preservation or preventative approach of Ayurveda for the client's wellness, client's health, and client's disease management. Okay, so I'm very happy to share that our cleansing programs are getting busy and busy and busy, as I'm very happy to see that clients are getting more aware of Ayurveda, as I'm happy to see many of us are sharing the word of Ayurveda, as we are sharing the word of a good diet, good lifestyle, good maintenance of the body, good practices, good services, good self-care, good care, the Ayurvedic care for different regimens, the way we practice on the day-to-day basis. So we are sharing as much as we can to create this awareness in our surroundings, in our social, in our environment. And this is what Ayurveda is. Wherever you are, you practice Ayurveda in a very specific way and a very specific ways of looking at that location. Okay, looking at that location, looking at the person, looking at the time of the time of the nature where you are located, also the time of your body and time of our environment and time of the day. All the timings are very important to heal a person through the Ayurvedic approach. So Ayurveda is a science where we are given the importance to the physical body, where we are given the importance to the mental body, where we are given the importance to the emotional body, where we are given the importance to the spiritual body, where we are given the importance to our the conscious body, the consciousness, beyond the spiritual. We are also talking about the supreme levels of consciousness. So Ayurveda has given importance to all these different levels, along with your social environment and your environment around you. So these are all the different factors, these are all the different measures you need to think of when I am offering the healing for my clients. Because the way I have studied Ayurveda, it makes a lot of sense to me nowadays that if we manage our health and if we manage our wellness, the way we have the way we are practicing from not less than 10,000 years, I will say. I will say more than 5,000 years for sure, because we started writing the scriptures from the 5,000 years plus. But before that also, we were practicing Ayurveda this way. That's where we used the oral traditions. That's where we used the sharing of Ayurveda or passing of Ayurveda or offering the Ayurveda through the oral traditions. So I hope this is helpful to you, and I will say goodbye. Hello. Hi. Good afternoon. Ready for us? I am. Okay.